Yeah, welcome back after that short break. It is Health, Hygiene and Wellness. I'm having Dr. Silas Wambulwa from Kitale County Hospital. We are discussing about cancer and awareness, creating awareness about the different types of cancers and how they can be treated. Now, Daktari,
yes,
if we can go straight again. Can stress cause cancer?
Stress.
Yes.
Yeah, when you ask that, and currently the country is going through a lot of
yes, many people, a huge number of people are depressed.
Yeah.
Can that cause cancer?
What stress does is that it stimulates the always silent hormones in our body to come up. They can do anything to your body. They can cause hypertension, they can cause anxiety, they can cause any type of disease. But stress directly does not cause cancer, unless I do more research about it. Cancer usually comes because of mostly the change in the genetic maybe composition of the cells. So whenever they change, there is a risk for cancer. But yes, stress causes anything. So it's possible. It can, because it predisposes you to even poor feeding, It doesn't cause it direct, but indirectly. Because a person who is stressed, most of the time, depending on the type of stress, they might not feed well. There is this binge drinking because of stress, There are people who smoke because they are stressed up. There are people who develops different lifestyles because they are stressed. So that's lifestyle. Even sexual life, we will see in cervical cancer. Whenever you have multiple partners, whenever you are having sex early as a young child, that's what we are discussing in the Cancer Summit. We have girls who are having sex very early, at the age of 9 years, 10 years, when their reproductive system is not mature. So it could be because of stress, or maybe an exposure to certain kind of, maybe there are children who have been abandoned, you see, they are street children, so they will get stressed up. Then maybe another way of thinking they are reducing stress is by having sex. So by having sex, already they will be having a risk for cancer. Yes. So it doesn't cause it directly, but maybe through our lifestyle. Yeah.
We find that 2% of children under the age of 18 years are in the advanced stage of cancer.
Yes.
Now, which type of cancer is prevalent to this age group?
Pediatric cancer is funny because it depends with many things. Most of the cancers in pediatric cancer, they are caused by parents. We have parents who, for example, they smoke cigarettes. I'm sorry, today I'm really talking about smoking. They use different types of tobacco, like shisha. Shisha is tobacco. Yeah. Only that is a very expensive tobacco.
Lifestyle.
Yeah, so there are these ladies who've been taking shisha, then they get pregnant. So this tobacco is still in the body.
It's still in the system.
Whenever they get pregnant, this child will absorb, will maybe inherit some cells that will give them a risk of cancer. We have this cancer like retinoblastomas. These are just cancer that affect children. They affect the kidneys, the eyes. Retinoblastoma is maybe for the eyes. So you find that when a child is born, the eyes can't see. So some people might think it's just a different disease, and yet it could be retinoblastoma. And retinoblastoma can be healed 100%. If you see an eye doctor early, these children who are born with, let me call it a white eye in a layman's language. So take them to hospital, you realize it could be a retinoblastoma. A retinoblastoma is a childhood cancer that can be healed. We have those things we call Hodgkin's lymphoma, non-Hodgkin's lymphoma. They are very common in children. We have cancers of the adrenal gland, the kidneys. So they are very common in children, and they can cause other diseases. So there are things that if people come to us early, we diagnose, they can be treated. The good thing about children, the rate of healing of cancer in children is even higher than for the older people. Why? Because children have growth, new cells growing.
Yes.
the size of the hand today of a child is not this of a child who is 2 years.
Yes.
Won't be the same after 10 years. But for a mature person, the growth spurt is not
It is,
there.
yeah,
The
it's
growth
so
rate is
low.
so low.
Mhm.
So what we are struggling is, we are just struggling with these new cells that are coming up to remove them. But for the young people, you remove an abnormal cell, we already have a new cell that is waiting for the abnormal cell to give its way, so that this new cell can take its position. So that's how good or easy it is to treat pediatric cancers. But the other challenge, now that you've asked, is that most women or most parents don't realize that their children have cancer until it's too late. Because also children, they don't obviously tell you the symptoms. They will always tell you, I have a headache, I have what, or they might not even complain, they may just cry. So whenever they are crying, you don't know if they have a growth in their abdomen. A normal, a mature person will feel that there is a growth in your abdomen, but a child will not know that. That's the challenge that we have in children.
And Dr. how do I check if I have cancer?
Yes,
I would really love to, even myself, to find out if I have.
It's a good question. It's good that now we are having this cancer summit, and actually it's the inaugural cancer summit that we have had in Kenya with so many partners, and we are speaking voices against cancer, because we have included everybody. The cancer survivors are there, the NGOs are there, everybody, the well-wishers are there, even the people from the church, how do you call them?
The clergy.
The clergy is there, because we speak to people. If you don't speak to people, they will not know that there is cancer. There are people who don't know that there is cancer until cancer comes to your house. That's when you realize there is cancer. So the only way to prevent cancer is to screen. So just come to the hospital. All doctors nowadays, they are trained in the university to screen for cancer. Nurses are trained in the university. We are training even in the Kenya medical training colleges how to screen cancer. So any healthcare professional who comes from a college or a university, they know how to screen for cancer. They know it. So a dispensary that is close to you, a health center that is close to you, they are able to know if you have cancer or not, if you are at risk of cancer or not. Because cancer does not just involve us taking you to a CT scan or no. There are first questions we ask you, your lifestyle. I like speaking to the young people, because the life we live today determines if you will have cancer after 40 years or not. These young people, the very vibrant young people from 20 to 35 years, the life you are living at 20 to 35 years will make you have cancer after 40 years, or you may not have cancer. So this cancer that people have at 40, 50 years, 60 years comes because of the life you lived at in your 20s. When you start earning that small money, you start smoking, you start taking alcohol, you stop doing exercise, unapanda pikipiki. I told you the economy has changed. Nowadays, even the person Mayako, if you look at their phones, they have borders, almost
Uber.
Yes, Uber, there is Uber nowadays. You see, there is taxi in Nairobi. People don't walk. You just come from your office, there is a Kawasili there. You go to your home, sit on TV. You can't even move. There is a remote there.
You binge eat.
Yeah, you binge eat. Morning you wake up, go to the office. So we are saying you have to screen. When you come to a doctor, we'll tell you what you are doing is not right. You might get cancer. Number two, for things like prostate, there are ages that we know. For example, women from 35 to 50 years, there is a high risk for breast and cervical cancer. That is obvious. 35 to 50 years, you need to screen. After every 3 years, you need to check your cervix. After every month, you need to do self-breast examination. Right now, we have human papilloma virus screening tests. People need to go for those screening, because they will prevent cancer. For men, so that we don't forget the boy child, the esophagus. Esophageal cancer is actually killing men. You realize men, they reach a place where they can't swallow. So it's because of cigarette, mostly tobacco use, is causing esophageal cancer. It is easier. Come to the hospital, we'll do an X-ray, we'll see if you have an esophageal cancer. NHIF caters for that. Prostate cancer, very common for the old men from 45 to 70 years. So there is a risk for prostate cancer in men, and you've seen how it's killing our people. Come to the hospital, we'll be able to check. It's not expensive. I think looking for a prostate costs you only 1,000 shillings. And if you have NHIF, it's free. Yeah. So most facilities, the services are free. Then lastly, for the colorectal cancer,
yes,
mostly if you go to a hospital, you don't need to be scanned for you to know that you have a colorectal cancer. The symptom of blood in stool gives you a risk for cancer. I know we have hemorrhoids and other things,
yes,
but when you have blood in stool, there is a risk for cancer. But also, a doctor who is very sharp can be able to pick a growth or maybe an abnormal growth in your abdomen by palpation. They just use their hands to check if you have a growth in your abdomen. Then they send you for scanning. If it's cancer, it will be known. Yeah. So it is very simple.
So for a person who is going to the hospital, do I just come and say I want to screen for cancer, or I should point out the specific type of cancer I want to screen?
It depends. If you are having symptoms, just as we've mentioned, symptoms relating to the breast, for example, for a woman, just go straight to the doctor. Tell I have a feeling there is a lump in my breast.
Yes.
So just screen for my breast. A good doctor will not screen for the breast alone. They'll also screen for the cervix. And if possible, they'll also check your stomach to see if there is cancer in your colon.
Yes.
So you already have screened for all of them. Yeah. But if you also want to screen for cancer, just come to the hospital. Say, I have no symptom, but is there any cancer that can affect me? For example, you are 40 years. Ask doctors, ask clinicians, nurses, know which cancers can affect you at 40 years. So we'll just tell you to go and screen for this cancer A, cancer B, cancer C. Yeah. And you know, in medicine, we usually say more common things appear more common. So these cancers are very common in 40 years.
Yes.
We'll always screen. The ones you've given as the statistics, they are the ones we'll screen for. Then the others, we can start screening later on if we feel these ones are normal. So we don't go for the uncommon. We go for the common first. So once we are done with the common, we know they are negative, we start going for the uncommon. Yeah, for example, a cancer of the nose, not very common, but we can also screen for it later on.
Yes.
But if you are a woman, let's start with the breast, the cervix, then go to the
ones that we are more prevalent.
Yes.
Yes.
Yeah.
Okay, now, and how does one, if you can just explain to us the process of treatment?
Yes.
From stage 1 maybe to the later stages.
Yeah. In the cancer summit that we are having, we brought cancer survivors, we brought cancer patients, and if you listen to the stories they are telling us, it's expensive to treat cancer. It is. Because first of all, the expense comes in the delays. Our country has very few machines that can treat cancer. In fact, nowadays you just go to Nakuru, MTRH, KNH, Texas, which is private. That's where we'll get the treatment. And we also have, let's not forget, the group of patients who are going to India. So you know that.
Yes, yes.
Yeah.
There's a huge group of people.
Yeah, there's a huge group of people who are going to India. And we are requesting them that we will also have these services in Kenya. So the expense of going to India is also very high. So first of all, go to a cancer center in Kenya. If you feel the doctor refers you to India, the better. But it is expensive. So the process of treatment starts with the diagnosis of cancer. The biopsies, the cytologies, those are the things we use to diagnose cancer. Once we have diagnosed you, it will depend with the staging. So the biopsy will give us the staging. Once we do the staging, now we start the journey of cancer treatment. So if it's just a cancer that is localized, we call them localized cancers, which have not spread. Metastasis is a term we use when a cancer has spread. Yeah, we call it metastasis. But a cancer that has not spread, it's actually localized. It is easier to treat than a metastatic cancer. So a metastatic cancer or tumor means you have to really do an invasive procedure to remove it. Probably you might remove some organs, the organ that is affected fully. For example, if it's the breast, if it's metastatic, you might have to remove the breast
itself,
and maybe one rib, because the rib has been affected, so that now you throw away the cancer cells. And after that, there is a risk for the nearby cells. So we have to do what we call radiotherapy or chemotherapy, just to make sure that if there are any cancer cells that were moving in the blood at the time of diagnosis, you also suppress them.
How do you choose between radio and chemo?
Radio and chemo, they move together. Depends with what you find when you treat this cancer. If you have a feeling that the cancer is just localized, it has not moved to the blood or the lymph nodes, maybe you can do radio. But most oncologists, I'm not an oncologist, but most oncologists, they decide. They decide what to do. They can do chemo and radio both. They can do radio alone. They can do chemotherapy alone. And there's also surgical intervention. Yeah. And all these things are expensive, but we are glad because of NHIF, after a long persuasion, they are taking care of some of the bills relating to cancer. Yeah.
All right.
Yeah.
Now, that is the whole thing about treatment.
Yeah, that is it about treatment. So it becomes complex. The earlier you come, the simpler it is. The later you come, the complex it is. So that's why we are here on TV. We are not here to really encourage people to come to us in stage 4. Let them come to us in stage 1. Cancer is there. Cancer is real. Let not people fear. You know, I wonder, people who walk in the streets and they say that, you know, I feel like if I get diagnosed of cancer today, I will die. And they give you examples of their relatives. Oh, this relative A was diagnosed of cancer, they died the following month. This relative A was done surgery, they died the following month. This relative A, who didn't know they had cancer, but they had a growth, never went to the hospital, they lived for 10 years. You see those stories. But now, the bad thing about cancer, it depends on the type of cancer. For example, cancer of the uterus and maybe cancer of the colon, you can stay with it for so many years without any problem, because if you look at the blood supply in the intestines, it's not high. But cancer of the mucous membranes, for example, cancer of the gums, you can't stay with it for long because there's a lot of blood supply in the gums. The gums are just pink if you look at them closely. So there is a lot of blood supply, so it moves very fast. So that's why we are requesting the people who talk about that, they are not doctors. Why don't they come to a specialist to advise you? Because maybe your relative had cancer of the jaws, which spreads very fast. That's why they died early. The others had cancer of the abdomen, which does not spread very fast. So don't make it complex for yourself. Go to the expert. We will now understand and tell you that this is the procedure, and they will help you. Yeah. So that really determines the length of stay, the cost of treatment, the type of treatment. Yeah.
Assuming now I'm healthy like I am right now, I thank God.
Yeah.
How do I avoid getting cancer?
Good question. And you are a young man.
Yes.
My strength is in the young people because I'm also young. Your food, your lifestyle is very important. When you reach 20 years, the risk of cancer starts. And it starts from your mouth. What you are putting inside your mouth gives you a risk for cancer. You will eat, you are very healthy. You can even go to I've seen friends who take beers, my friend. They can take even 2 crates of beer. And they still go back home and they take one for the road. You've seen them.
Yes.
Yeah. And they're just strong. But give them a few years, you'll find this young man, they are now having a disease. There are people who are smoking very many packets of cigarette in a day. but they are very strong, they are very healthy, but give them a few years, they'll be sick. So what you are eating today, what you are exposing yourself to today, there are people who love sodas, these sodas, you know, they are not bad. They have been taken for so many years, like Coca-Cola company has been there for so many years.
Yes.
But now, after so many years, you get a disease. So your lifestyle today is the key prevention. Number 2, prevention is screening. You are a human being. You can get cancer anytime. We are not saying cancer is a disease of the old people. Cancer starts from birth. As long as you have cells in your body, you can get cancer anytime. So you get screened so that the doctor can tell you you don't have cancer. It costs nothing for somebody to tell you you don't have a disease, isn't it? Yeah, because you just came, I've told you, Nicholas, you are okay. You don't have any disease. In fact, you will feel rejuvenated. And I've also added to you a package of advice to help you prevent cancer.
Yourself from cancer, yes.
It's not the same as somebody who's just staying there and enjoying life. And yet, you know, I've had people who say, let cancer come, it will just kill me once. No, it will not kill you once. It will spend all your resources. You will leave your family. I've seen families who have been left poor. They have sold land.
Yes.
They have done, you know, the quality of life is so bad when you develop cancer at late stages. So just come. Don't listen to people. Just come to us. We screen you. We tell you there is no cancer or there is cancer and we are going to treat you. It will prevent the cost. But if you come to us, you've left it and it's to stage 4, it becomes difficult for you. Yeah.
You mentioned NHIF.
Yeah.
Does it cover the cost of treating cancer?
Yeah, it does. It does. I've seen even it covering people who are traveling to India for cancer treatment. It does. Yeah, it has helped a bigger percentage of people. The inpatient, you know, when you get cancer like stage 4, you will need to be in hospital most of the time. So you will need to be admitted. So when you get admitted, at times you realize that you will spend a lot. But if you have NHIF, it covers for you. But there are some treatments that are very specialized that people have to get their money. So for example, some type of chemotherapy, NHIF cannot cover for that. So people have to buy the drugs. Some operations, specialized operations, radiotherapy, at times even surgery, interventions like surgery, sometimes NHIF cannot cover that. So CT scans, diagnosis, we've really pushed NHIF to support in diagnosing. So we are able to do ultrasounds, we are able to do those barium meals, barium x-rays, we are able to do those CT scans with NHIF. So NHIF is there to help you. It says you to pick the NHIF card, then go to any hospital, ask them to screen you for cancer.
Yesterday I saw the CS for Health.
Yes.
After the summit, she had a meeting with the press, and she was talking about the National Social Health Insurance Fund that is being introduced in to cover NHIF. Yeah. What is the difference between the two?
Sincerely speaking, I really don't know. I need to go and check. But they are one and the same because, you know, NHIF has its own merits and demerits because you realize that some of the government hospitals don't offer their services in the lower level facilities. That's why at one point we had, which is still there, we had even UHC, Universal Health Coverage. So what we want to do is that we want to reach that person who is in the low level setup. Where there is a health center or maybe a dispensary, and they can get the same services as somebody who is in the higher level facility. Because what these higher level facilities are doing is that they are screening and treating. But we want to screen and prevent, you see? So there's a difference between screening and treating and screening and preventing. So we screen you, we tell you you are negative, and we prevent you from getting the disease. So that's why we are pushing to a system. Like for example, NHIF, if you have NHIF today in Kenya, you can only be treated in a sub-county hospital or a county hospital. Why? Because the drugs are available there. If you go to a dispensary, the services are free, but the tests are not there. The services are not available. The drugs are not available. So NHIF is not helping you if you are you go to a dispensary. But if you go to a sub-county hospital, a county hospital, you are getting some services. So that is the difference now. I think when they are talking about UHC and whatever you said,
yes,
they want to move it, to push it closer to the patient. Yeah.
All right.
Yeah.
Thank you so much, Daktari. Now, as we wind up, I hope that you have been educated much about cancer. And as we begin this awareness month, the month of February, about cancer, I challenge you and I challenge myself at the same time that we go for screening for cancer. We've reached the end of Health, Hygiene and Wellness. My name is Barasa Saenyi. I've been hosting Dr. Silas Wambulwa from Kitale County Hospital. Till next time, bye-bye.